Well, good morning, everybody. I'd like to welcome you to Community Rehabilitation Hospital. I'm Doug Beebe. Honored to serve as the CEO of this beautiful new facility. Also honored to be leading a very talented team of physicians and caregivers that we've assembled to deliver intensive rehab services to treat patients with complex medical conditions. In a few minutes, we'll complete this brief ceremony. You'll have a chance to tour the facility and meet our team members. I'd like to thank a few key individuals who have helped make this project a success. Brian Mills, the CEO of Community Health Network. Pat Foster, who is the CEO of Centare Healthcare and our joint venture partner. Robin Ledyard, is Robin out there? Robin hasn't made it yet. She's the president of Community Hospital East, so she's kind of busy. The new Community Hospital Rehabilitation Leadership Team. Dr. Allison Williams, our medical director. Dr. Robert Lindeman, who is the interim president at Community Hospital North. Our team of architects and developers and contractors. We had a great team from Earl Swenson, Duke Realty, and Pepper Construction. Lastly, and perhaps most importantly, I want to thank Neil Trout and Randy Klesmer, who are two of the many donors to the Network Foundation who've been very generous with helping us with Hook Rehab. So I'd like to have everyone thank them with me. The timing of this new hospital, the coming when everyone's going through graduations, made me think about commencements that we all have in our lives. And it's one of those ones where you have mixed emotions as you see people enter new phases. We've been at Community Hospital East since 1974, so this is a big jump for us. Very exciting as we leave the partners and relationships that made us a very good program as Hook Rehab and transition to Community Rehabilitation Hospital. Joining the North Campus and leaving East is one of those things where we feel like maybe we're growing up, but we're leaving a lot of friends behind. So we want to thank Community Hospital East, who really helped us be who we are. It's a really strong move for us for many reasons. We think our rehab program will be greatly enhanced by a custom-built facility, and we're partnered with a world-class partner, Centare Healthcare, that's going to really lead us to a new level of expertise and excellence. Community Health Network is going to gain better capacity and better access to a specialized service that people need desperately at these times. And finally, the move of this hospital to this building allows Community Hospital East to refocus on the missions it's had since 1956, serving the people of the East Side, and really be able to do that well and be the premier provider of healthcare services on the East Side of Indianapolis. We will continue the tradition of excellent programs developed by and utilized at Hook Rehab. We have a new name. It's a new hospital, a Community Rehabilitation Hospital, but the tradition that we established with Hook Rehab will be maintained and enhanced. This facility is designed to allow us to treat the kind of patients that we see now, so very complex neurological issues, brain injury, stroke, spinal cord injury, Parkinson's disease, multiple sclerosis, as well as other very complicated medical conditions such as burns and amputations that require full physician coverage, 24-hour nursing, and intensive therapy. So we're really excited about having our physician team, our therapy team all in place to work side by side with the community hospitalist group so that we'll have great medical care paired with great rehab care so our patients are going to have great outcomes and head home. Our new hospital positions our network to strengthen a specialized portion of the care continuum as we move into the future. And we all know the premium is going to be on efficiently caring for patients and assisting them to return to their loved ones in their community, and that's what we're built to do. With the construction of the Community Rehabilitation Hospital, the Community Health Network is making a long-term investment in providing post-acute care. And I'm very proud and humbled to be leading this effort, and I hope our graduation is a successful one. So thank you all for coming, and I'd like to introduce Brian Mills.
Hey, thanks, Doug. And I'm just so excited to be a part of your new endeavor in this new hospital. I have a unique perspective standing here on this campus, and some others out there do as well, but the hospital behind you, next Wednesday, it'll be what would it be, 85, it'd be 28 years. That 28 years next Wednesday it opened, and so we were here for this ribbon cutting and all the things that have happened, and healthcare has changed so much in that period of time. And this is an example, once again, of what happens when partners come together. And you take the best of both and you create something that you can't create on your own. We were looking for a partner, and we found Centare. And this is the beginning of a partnership. It's not the end. We're opening a building, but we're just now beginning to provide the services and the value to the community, the small C community, that this is all about. A number of us spent some time this morning with MD Anderson, another partnership that we announced. And we spent our time going through the first 6 months of our data, looking at, are we in fact delivering what our promise was when we set out to say we're going to bring their know-how here? Because that's what this is really all about. And Centere, as Doug said, is a leader. This is what they focus on. This is what they've studied. This is what they're the best at. And we're going to partner to make sure our patients receive the best and have it in this new facility. So I'm delighted to be a part of this and a part of many partnerships. With all the changes in healthcare, partnerships are critical. Resources are scarce. The expectations of value are changing daily. And we've got to be willing to look for other people that want to work with us. And so I'm delighted to introduce my friend Pat Foster, our new partner, and look forward to working with him and learning from his know-how and making sure that our patients that walk into this facility or brought to this facility have the best chance possible for the best recovery, and we know that we're committed to doing that. Thank you.
Good morning, everyone. Thank you for those kind words, Brian. First of all, I would like to ask, are there any individuals here who have actually received services from the Community Health Network? If you could just raise your hand. I think it's really important for me to recognize and thank you for your presence here today. I can talk about the quality of the organization we're partnering with, but you've experienced, I can tell you, it's the best team that I've ever worked with in my life. But you've experienced the quality of the services, and I thank you for taking the time to come today and participate in this a beautiful grand opening here. I would also like to not just raise your hands, but the clinical staff and the administrative staff of the Rehabilitation Hospital. I want to ask you to step forward, please. Oh, there's Bullet. I was teasing earlier. I said I'm going to invite Bullet to speak in my place. Bullet is a 3-year-old lab that's a therapy dog, and what a wonderful asset that's going to be. But this is all about you, the team. This is a beautiful facility, but I want to thank you from the bottom of my heart for coming over from Community Health and those that did not, that have joined this team. You've got an awesome team here, and let's give this team a big round of applause. And you are what it's all about, and again, thank you for being a part of this team. And you got a great leader here. So with that, I want to thank the developer of the project. I think you did all of that, but I do want to recognize some of my team members very quickly, team members from Centera Healthcare. Matt Herb, who is the project manager for us, looks like I asked him driving up yesterday. You see those black glasses he has on? I looked at him and I says, Matt, has anybody ever told you you look like Clark Kent? And those, and he said, no. And I said, well, that's good because you don't. Matt has really done a wonderful job bringing this project together. And Rudy Blank and David Caniff and Tammy Ober, if you just raise your hands, please. And again, the most important a member of our team is Lori, who is a registered nurse and is one of our clinical. Lori, I'm going to ask you to step forward and raise your hand. You've been working with the team here on the clinical side. Is she not here? There you are. Okay, she's shy. But thank you for all that you've done. So I just want to express the purpose of this facility and the team that we join with, and make a commitment to this community, Brian, to you and the Community Health Network. This facility is committed to superior clinical outcomes, superior patient satisfaction, superior physician satisfaction, superior family satisfaction, and superior partner satisfaction. We realize that healthcare is delivered in this local market, and you do a fantastic job, and we just welcome the opportunity to enhance the rehabilitation services in this local market. So thank you for that opportunity, and please pass my thanks on to your board. And in closing, I said I was just going to make this comment. I told Dr. Wong, I said, Dr. Wong, I'm going to close, and I'm going to say, Doug, I expect a telephone call from you in a year, and you're going to say, Pat, I told you we should have built 80 instead of 60 beds. And good old Dr. Wong, and Dr. Wong, raise your hand. I think everybody knows you here. He said, you know what, Pat, I think you're wrong on that. I think you'll get that call in 6 months. So love you, Dr. Wong. So thank you all for joining us today. And again, thank you for the opportunity, Brian.
Thank you, Pat, for your leadership and partnership. And thank all of you for joining us on this historic day. We have a new name and a new hospital, but we have the same conviction to transforming lives. We're now going to cut a ceremonial ribbon and officially open the Rehab Hospital. So following that, please join us for tours inside. Pat and Brian, if you would join me at the ribbon, and our hospital leadership team, and along with Dr. Lindeman and Rudy Blank, and our physicians, please join us to do the ceremonial ribbon cutting. Great.